Good day, future doctors. So for today, we will be discussing about the lung fluke, the Paragonimus westermani. Trematodes can be classified based on their habitat or the location where we can find them in our body. When you say blood flukes, they can be found in the blood vessels. Particularly, I'm referring to the adult stages. When you say liver flukes, the adult worms of these trematodes are found in the liver, but I have to clarify this one. The adult worms of liver flukes are actually found in the bile ducts. It is only when the infection will become severe that's the time that you will also see adult worms in the liver parenchyma. So, take note ha, even if we will refer to them as liver flukes, the adult worms are found in the bile ducts. Intestinal flukes are found in the lumen of the intestine. And we have the last one, the lung fluke. The adult worms of the lung fluke are found within the cavities or capsulated areas in the lungs. We only have one blood fluke, schistosoma. We have several liver and intestinal flukes. And another good news, we only have one lung fluke that is medically important, and that is Paragonimus westermani. Let's try to take a look at the life cycle of the only medically important lung fluke. The adults are found in the cystic cavities within the lung tissue. The adult worms are actually covered by a capsule. The capsule has holes where the eggs could be released. Now, the eggs might be released through the sputum, but if the person will swallow his sputum, there's a chance that the egg could also be discharged through the feces. So we have two diagnostic specimens in the diagnosis of paragonomiasis. We have the sputum and the stool. What will be seen in the sputum and the stool is the egg. And Paragonimus is one of those trematodes that will lay or discharge an embryonated ovum. Can you remember PEFF? The P there stands for Paragonimus. That's the reason why that the number one part of the life cycle is showing us that what is discharged out from the human body is the unembryonated ovum. So this egg has to stay first in water for quite some time before it will be able to release the ciliated stage, which is the miracidium. This miracidium will infect the first intermediate host, which is all the time a snail. Inside the body of the snail, the miracidium will lose the cilia and will be enclosed in a sac-like structure which we will call as the sporocyst. The sporocyst will give rise to the feeding stage, and that's the rhidia. The rhidia will give rise to the tail stage, which is the cercaria. And what will emerge out from the body of the infected snail is the cercarial stage. Take a look at the cercaria of Paragonimus westermani. Please classify it based on its morphology. It has a short tail. Therefore, this is a Microcercus cercaria. At this point, we will now identify the second intermediate host of Paragonimus, where its metacercaria will develop. The second intermediate host of Paragonimus westermani is actually a crustacean, a crab, and a crayfish. So, the cercaria will enter through the soft parts of these crustaceans, and they will insist themselves on the bodies of this second intermediate host, and they will become the metacercaria. Ingestion of raw crabs and crayfishes will now predispose a human host to develop the infection. Paragonimus westermani is popularly known as the oriental lung fluke. Don't worry, this is the only lung fluke that you need to memorize. The infective stage to humans is the metacercaria. The diagnostic stage is the unembryonated ovum. You really have to specify that it is unembryonated. Diagnostic specimens include sputum and stool, especially if the person will swallow his sputum. Now, what are the intermediate hosts? We have two, right? We have the first and the second. Snails act as the first intermediate host. But what particular snail? It's Antemelania asperata. Please do memorize the scientific names of the host. In the case of second intermediate host, we have the crustaceans, crabs, and crayfishes. The most popular of which is the Sundatelfusa philippina or the red crab. The first intermediate host is a snail and it's Antemelania asperata. The second intermediate host is a crustacean. It could be a crab or a crayfish. The most popular one is the Sundatelfusa philippina. These are the pictures of the red mountain crab or the Sundatelfusa philippina, the second intermediate host of Paragonimus westermani. Eating these crabs raw will predispose you to develop paragonomiasis. Crayfishes can also harbor the parasite and become the second intermediate host. The diagnostic stage of Paragonimus is the unembryonated ovum. I want you to take a look at the ovum in the PowerPoint slide. It is elliptical in shape. It can be yellowish to brown in color. It has an operculum, which is pointed by the red arrow. Do you know that the ovum of Paragonimus almost look the same as that of the other members of the PEFF acronyms, the Echinostoma, the Fasciola, the Fasciolopsis. But there's one feature that you can check on the egg or ovum of Paragonimus that will help you identify it from EFF. And that is the thickened posterior end, and that's the one encircled in the picture. So meaning, the eggs of Paragonimus, Echinostoma, Fasciola, and Fasciolopsis are all elliptical in shape. They are all yellowish to brown in color. They are all operculated. What will help you distinguish Paragonimus eggs from the eggs of the other three is the presence of the thickened posterior end. Doc, why do you have to remember this? Let me be clear with this one. Fasciola is a liver fluke and it is found in the bile duct. Once it will lay egg, the egg will be passed out on the bile into the duodenum. Therefore, the egg can come out in the stool. Fasciolopsis and Echinostoma are intestinal flukes. So once they will lay their eggs into the lumen of the intestine, the eggs could be passed out in the stool. The Paragonimus egg can also be found in the stool if the patient will swallow his sputum. So the eggs of the 4 parasites can be found in the stool. So it's very important for you to memorize how to identify the Paragonimus eggs from the eggs of the other 3 parasites. Again, the ovum of Paragonimus is elliptical in shape, it is yellowish brown in color, and it is operculated. And for you to differentiate it from the eggs of Echinostoma, Fasciola, and Fasciolopsis, you have to check the posterior end. It should be thickened. This is the ovum of Fasciola or maybe Fasciolopsis or Echinostoma. Elliptical in shape, operculated, yellowish to brown in color, but the posterior end is not thickened. This is another picture of the egg of maybe Fasciola, Fasciolopsis, or Echinostoma. Elliptical in shape, yellowish brown in color, operculated, but the posterior end is not thickened unlike that of Paragonimus. The growth stage of Paragonimus is dorso-ventrally flattened just like the other trematodes except for Schizosoma. One unique characteristic of the adult worm is that it is reddish-brown in color. That's why it is sometimes mistaken as blood if it is passed out in the sputum of the infected individual. The adult stage of Paragonimus is usually coffee bean in shape. So I will show you later on a picture of a coffee bean and the adult stage of Paragonimus for you to really appreciate that the adult stage looks like that of a coffee bean. Another distinguishing characteristic, the ventral sucker of the adult stages of Paragonimus is found in their midline or middle portion. In other trematode adult worms, the ventral sucker is somehow found near the oral sucker. In the case of the Paragonimus, the ventral sucker is found in the middle part of the body. Shown in this PowerPoint slide are pictures of coffee bean and that of Paragonimus westermanni. So therefore, their adults really look like coffee beans. Let's try to identify some of the parts of the Paragonimus adult. You have there the oral sucker. You have their unbranched intestine because there's only one trematode that has a branched intestine, and that's fasciola. I hope you can still remember that. Take a look at the ventral sucker of Paragonimus adult. It is found at the middle or central portion of the worm. This is fasciola, one of the trematodes. Pointed in the picture is its ventral sucker. Appreciate that the ventral sucker is found near its oral sucker, but in the case of Paragonimus, that ventral sucker is found in its central portion. Let's try to identify the other parts of the worm. You have there the paired lobed testis. Anterior to the lobed testis, you have there the single lobed ovary. And on the lateral side of the worm, you have there the brown colored uterus. Again, paired lobed testis, single lobed ovary, and then you have there the brown colored uterus. Not obvious in the picture, but I want you to imagine that there are vitellaria on the sides of the worm. Since the adult worms of Paragonimus westermanni are found in the cystic cavities within the lung tissue and they will be creating damages in there, expect that the patients with paragonomiasis or infection with Paragonimus would present with persistent chronic cough associated with thick brownish red sputum. Red because there could be hemoptysis, and sometimes it's red because of the presence of the reddish-brown adults. That's why a lot of cases of paragonomiasis are mismanaged as tuberculosis because these patients will present with hemoptysis, which is also a presentation of someone with tuberculosis. That's why as a doctor, if you know that the patient has already completed the medicines for tuberculosis and yet there is that persistent chronic cough associated with hemoptysis, it's time to entertain possibility of paragonomiasis. But as a doctor, you should have asked from the patient during the first consultation if the patient has eaten raw crabs, because that can really help you diagnose the patient as paragonomiasis and not tuberculosis. Physical examination of the chest of patients with paragonomiasis would usually reveal normal findings. In some cases, some patients would develop pleural effusion and pneumothorax as complications of probably severe infections with paragonomiasis. As I've mentioned a while ago, the Paragonimus adults would enclose themselves in a capsule, forming now cavities in the lungs. Aside from that, they can also initiate granuloma formation. Within the cystic cavities, you have their blood-tinged purulent materials containing the eggs. And these cystic materials will be discharged through the holes in the capsules. so that they can be discharged through the sputum or the stool. Do you know that we have what we call ectopic paragonomiasis? What do you mean by ectopic paragonomiasis? The adults are found in organs other than the lungs. Sometimes they can be found in the muscle. Sometimes they can be found in the abdominal organs, genitals, brain, heart, and lymph nodes. Why? We refer to Paragonimus as a lung fluke. And then, at some point, they can be found in other areas in the body. How? Why? We acquire the infection by eating raw crabs and crayfishes, and what we are getting from them is the metacercarial stage. The metacercaria will reach the duodenum, but this metacercaria has to become an adult in the lungs. So for that metacercaria to mature as the adult, it must traverse through the wall of the intestine and escape into the peritoneal or abdominal cavity. Do you know at some point, this metacercaria will just wander around the abdominal cavity, and sometimes they might embed themselves on the wall of the cavity. And then later on, they will emerge out of the area where they are embedded, and they will now start going through the diaphragm towards the pleural cavity to reach the lungs for them to become the mature or adult stages. But sometimes, some of these immature flukes might wander somewhere else, thereby involving now other organs, resulting to ectopic paragonomiasis. Now, it would take the parasite 65 to 90 days to complete its development from metacercaria to the adult stage in humans. Do you know that the adult stage of Paragonimus can stay in our body for 20 long years? Paragonomiasis can be diagnosed by examining the sputum or stool of the patient. They would present with hemoptysis. That's why most of the time they are mistaken as tuberculosis. And most doctors would request that the sputum of the patient should be stained with acid fast. The problem with acid fast is that once you will apply it on the sputum sample, the acid fast stains or chemicals will destroy the eggs, and the medical technologists will not be able to see them, and that will now lead to the misdiagnosis of the case. That's why if you are the doctor and you were able to elicit from the history of the patient that the patient is fond of eating raw crustaceans, you do not just request for AFB. You also have to request the medtechs to examine the sputum for the presence of Paragonimus ova. Biopsies of the lungs will demonstrate granuloma formation secondary to the presence of adults in the eggs. Shown on the right side of the screen are the cystic cavities where the adult worms of Paragonimus can be found. In one cystic cavity, you can find 2 or 3 adult worms. Radiographic procedures will reveal the presence of multiple cystic cavities within the lungs. And if these cavities will be examined through biopsy, you will be able to see the presence of the adult worms. Praziquantel is the drug of choice. It is not recommended for use in pregnancy, although it has not been proven to be teratogenic. Treatment should be preferably be given after the delivery of the child unless immediate intervention is deemed essential or necessary. Should you give the patient praziquantel, it's very important to tell the patient to restrict from doing physical or strenuous activities. Why? Because praziquantel has the following adverse effects: dizziness, nausea, headache, pyrexia, urticaria, and abdominal discomfort. Another alternative treatment for paragonomiasis is bithionol, but most of the time, patients are treated with praziquantel. How to prevent possible cases of paragonomiasis? It's very important to properly dispose human waste to disrupt the life cycle. It's also important to eat properly cooked or sufficiently cooked crabs and crayfishes. And a very important way of preventing paragonomiasis and other infectious diseases, health education and promotion. And that ends my lecture on the lung fluke. I hope you have learned a lot of things from my discussion. Thank you very much.